Hey everyone, welcome to Mind Matters, the podcast where we talk about meds and mental health in a way that actually makes sense in real life. Today, we're getting into antidepressants, and honestly, this is something a lot of nursing students can probably relate to one way or another. Do y'all agree?
Yeah.
Yes. We're going to break down what they are, how they work, what you really need to know as a nurse and even as a person. And before we start, I just want to say this real quick. There is absolutely no shame in taking antidepressants. Asking for help and taking care of your mental health is a strong move and not a weakness. I'm here with my group, Bailey, hello, Zakia, Latanya, and Amanda. Everybody say hello and give everybody a big welcome. Okay.
So, quick overview of antidepressants. Antidepressants are a medication used primarily to treat depression, but they're also prescribed for anxiety disorders, OCD, PTSD, and even chronic pain. The most common classes include your SSRIs like sertraline and fluoxetine, your SNRIs like venlafaxine and duloxetine, your TCAs like amitriptyline and nortriptyline, and then your MAOIs like phenazine. SSRIs are usually your first line because they're safer and better tolerated, and then your MAOIs will be your last resort. Quick mechanism of action. So most antidepressants, they work by increasing the neurotransmitter in the brain. So that's mainly your serotonin, norepinephrine, and sometimes your dopamine. So your SSRIs, they block the serotonin reuptake in which it leaves more serotonin in the body. Mm-hmm. Your SNRIs, they increase serotonin and your norepinephrine. TCAs, they affect multiple neurotransmitters, but with more side effects and some serious effects like heart dysrhythmias and seizures. And then your MAOIs, they prevent breakdown of the neurotransmitters. So bottom line, they help improve your mood by restoring chemical balance in the body.
Yes. All right, let's talk about indications and contraindications. Antidepressants are used for major depressive disorders, generalized anxiety disorders, panic disorders, PTSD, OCD, and PPD. Your contraindications can include your MAOIs with certain foods like aged cheese that can cause hypertensive crises, using with other serotonin drugs, risk of serotonin syndrome, and caution in patients with suicidal risks early in treatment. Your common side effects depends on the class, but it also includes nausea, weight gain or weight loss, sexual dysfunction, insomnia, or sedation. Your serious risks include serotonin syndrome, which is indicated by agitation, fever, or confusion, your tyramine-induced hypertensive crises and your MAOIs, orthostatic hypotension on your TCAs. All antidepressants carry an FDA black box warning for the increase in suicidal thoughts, especially in young adults early in therapy. As nurses, we need to monitor mood and suicide risks closely. Educate the patients that effects can take 2 to 4 weeks, maybe up to 6 to 8 weeks to get the full effect. Watch for serotonin syndrome and avoid discontinuation. A lot of patients like to say, oh, I feel better and quit taking it. No, you need to stay on it. Monitor vitals and mental status. And always check with drug interactions, including supplements and over-the-counter meds, especially with your MAOI.
Yes, like Bailey said, don't expect immediate results. It's 6 to 8 weeks for the full effect. If you start feeling better sooner, please do not stop it. This is not a medication that you need to stop abruptly. Report any worsening depression or suicidal thoughts to your doctor immediately, because like she said, there's a black box warning for this one. Avoid alcohol. And also avoid grapefruit juice, as this interacts with multiple antidepressants, so don't touch it at all. Also, you would like to remind your patient that side effects often improve over time. So just give it time. Just continue to take it. And consult with your doctor if you feel any other way. If you start to feel worse.
Okay.
All right, and so we're going to look at a real-world case study. We're actually looking at a 22-year-old female patient who started sertraline for depression. She's been on it about 1 week. She's reporting no improvement in her symptoms, except now she's developed mild gastrointestinal problems, and she wants to stop taking the meds since she doesn't see any, benefit of taking it. So in this scenario, you as the nurse want to remind the patient that this med will take a little bit of time to work. It will take a couple of weeks, as she said earlier. The symptoms, adverse symptoms, they will resolve. You want to inform the patient that if they are experiencing any suicidal ideations, to discontinue the med and contact their doctor immediately. If it is an emergency situation, they can call 911 or they can call 988 and talk to a mental health provider. Now, in this situation, if this patient does develop any kind of agitation, sweating, or confusion after taking this medication, you just want to remind them that this could possibly be a serotonin syndrome, which is a medical emergency, and that they do need to seek health care immediately.
Cool.
Yeah, so if that was to happen, they need to go to the emergency department
Immediately.
right off the bat.
Right.
It could result in death.
And y'all think about it, these medications help us, but unfortunately, any medication that you take has side effects.
Yeah.
And that's just a part of how it's set up.
Right.
But to wrap everything up, antidepressants are essential in treating mental health conditions, but they require careful monitoring, patient education, and you have to give them time to work.
Right.
That's just a big part of it. But thank you for listening to Mind Matters. Stay informed, stay safe, and we'll see you next time.
Bye.